Okay, we are live.
Hey everyone, welcome back to another virtual shadowing session. Today we have Dr. Foster. She's an orthodontist, and thank you so much for joining us. We really appreciate it. So whenever you're ready, you can begin.
Yes, thank you for having me. I'm really glad that I'm able to do something like this with you all because I know right now with COVID, it makes kind of getting into dental offices and other kind of dental specialties a little bit more challenging. So I think this is a great way to kind of at least get some familiarity with dentistry if that's what you're thinking about pursuing. So I'll go ahead and kind of discuss all of these topics with you all. And of course, at the end, I'll be more than happy to answer any questions that anyone might have. So I decided that I wanted to be an orthodontist when I was 8 years old and went to my first orthodontic consult. My first orthodontic consult was about me being 8 years old and still sucking my thumb. So if you suck your thumb for a prolonged period of time, it can definitely change the way that your jaws grow and develop and the way that your teeth grow and develop as well. So my orthodontist showed me this really scary appliance, and he was like, if you don't want this in your mouth, you need to stop sucking your thumb. And I stopped sucking my thumb like that night because I was like, there is no way in heck I'm getting that scary looking appliance in my mouth. So everything I did from 8 until now, where I'm almost 30, it was to become an orthodontist. So I went to Florida Gulf Coast University in Fort Myers, Florida. I graduated there in 2013. I was there during their March Madness run for the first time, and that's like perfect timing since March Madness is kind of wrapping up here. I studied biology, and I was a pre-professional concentration with my major. The good thing about dentistry is that if you're not really interested in the sciences, you don't necessarily have to major in a science to be accepted into dental school. You can major in kind of what you want as long as you cover the prereqs that are needed to get into dental school. And just keep in mind that if you don't major in a science, they're probably going to ask you why. So just make sure you have a good reason on why you decided what you majored in. I went to Nova Southeastern University in Fort Lauderdale, Florida for dental school. I didn't get into dental school the first time I applied, which was very upsetting to me, but I feel like that's more of the rule than the exception. I feel like a lot of people that were in my class, for instance, were way older than me. For instance, when I started dental school, I was 23, and most of my class was above 25. So like 25, I think the oldest person in my class was 35. So if you do get rejected from dental school the first time, don't be too upset about it. It does take some people multiple application cycles to be able to get in. So what I did in between undergrad and dental school was I did a master's of biomedical science, which at the time was a bridge program into the dental program at Nova. So with that program, the goal was to really not get the master's. If you got the master's, that means you did that in the first year of that program and you got held back to do the master's. So the goal was really do good so you can get into dental school. So the way it worked was I was in all of the same science classes, taking the same exact exams as the dental class ahead of me, so as the class of 2017. So essentially I wore the same color scrubs. I went in, did all the same classes, all the same course loads, except I didn't do the dental science part of dental school. The catch with the biomedical program was you had to get a B or higher in order to have your seat saved in dental school. And if you got an A, you didn't have to retake that class in dental school. You just had to pay for that class again in dental school, which is kind of unfortunate. As far as that went, I got all of the A's because I was like, I do not want to be taking any of these again. I got 1B, I got an 89 in microbiology, and he wouldn't bump me up, so I retook it in dental school, but that wasn't that big of a deal. The good thing about that was it really freed up my schedule first year of dental school, which is usually somewhere between 28 to 32 credit hours, depending on the school that you go to. And I was really able to focus on the dentistry part of it instead of doing all those science classes. After dental school, I went to St. Louis University I just graduated, so I graduated in December of 2020. While there, I got a master's of dentistry, meaning I had to do a thesis project and defend a thesis project. And I got my certificate in orthodontics and dental facial orthopedics. I now live in the Raleigh-Durham area of North Carolina, where I work at Gladwell Orthodontics. We are a very Invisalign-heavy office, which is nice. It really gives you the opportunity to work with Invisalign probably a little bit more than I would at another office, which is awesome to get to learn that product really well. I hope in the near future I'll be able to tell you all that I'm a board-certified orthodontist. I did take my last set of boards at the end of February, so we're still waiting to hear back about those results. So fingers crossed that I can tell you I'm a board-certified orthodontist soon. So after undergrad, I did about 6 to 7 years of training just to become an orthodontist. So it will be 4 years of dental school, ideally, and then ortho programs kind of vary in length. They're anywhere between 2 to 3 years, and the program that I was at was kind of that sweet spot in the middle. It was 2.5 years. So what is orthodontics? So according to the AAO, it is the area of dentistry that helps prevent, diagnose, and treat dental and facial irregularities. So we study, like I said, an additional 2 to 3 years to be able to safely learn how to move teeth and to try to manipulate growth. And I say try because sometimes growth is something that can't be predictably manipulated. We do treat patients of all ages. I would say at my practice, because we are very Invisalign heavy, we do see a lot more adults, and we see kids too and adolescents. And the rule of thumb is we like to start seeing patients at the age of 7, because at that age we can really see if there's any interceptive treatment that we can do. Interceptive treatment means early treatment. So these were just a list of some important terms that you might hear me use throughout this presentation. So if I say the occlusion, that essentially is the bite. That's how the upper and lower teeth meet together. So if you bite down, that is your occlusion. A malocclusion is teeth that aren't properly fitting together. So it means a bite that is off or not ideal. Overjet is the horizontal relationship between the upper and lower teeth. And I'll usually use this in reference as protruding front teeth or like buck front teeth. Kind of think of SpongeBob when I kind of mention this. Overbite is the vertical overlap of the top and bottom teeth, and that can either be open or deep. If I say anterior, that means the front of the mouth. If I say posterior, that means the back of the mouth. If I say buccal or labial, that means the cheek and lip side of the tooth. If I say lingual and palatal, that means the tongue or the palate, which is the roof of the mouth, or the backs of the teeth. If I say distalized, that brings things backwards. If I say medialized, that brings things forward. And I did include a link. I don't know if you all are going to be able to click on it, but I did include a link for a more comprehensive list of terms that orthodontists use on the daily. So for a usual diagnostic case workup, what we like to do is we like to get the patient's chief complaint, meaning what is the reason why they came in. There's a wide range of chief complaints. Sometimes it's my teeth are crowded, sometimes it's crooked, sometimes there's spacing. There's just a very wide variety of chief complaints. We do an intraoral exam where we look at the teeth, how the teeth meet together, the relationship of the teeth. We look at the soft tissue, make sure we don't see any pathologies of the soft tissue. We also do an evaluation of the TMJ joint. That is the joint that your lower jaw kind of hinges. So every time you open, close, talk, that's what's moving, your TMJ joint. We take 9 intraoral photos and 4 to 5 extraoral photos. We do a intraoral scan, meaning we use an iTero at work, but there are a ton of different models of scanners. These create 3D models, which are easier to hold for that 7 years, which is how long you're supposed to hold these scans for. And then for children, it's 7 years after they turn 18. We take a panoramic radiograph, which is kind of like that smile-looking radiograph. and we take a lateral step, which kind of shows us the side of the head. Sometimes we will take a cone beam in the cases of impacted teeth, missing teeth, or other pathologies. So there are two types of phases to orthodontic treatment. Sometimes patients need both phases, and sometimes patients only need what we call a phase 2. So a phase 1 treatment is that interceptive, that's that early treatment I was talking about, and reasons why we want to see patients at age 7. This includes braces, space maintenance to make sure there's enough room for all the teeth to come in, guided eruption to make sure teeth come in the way that they're supposed to, palatal expansion, which is, expanding the top portion of your jaw, and to try to stop habits. So in my case, trying to stop a thumb sucking habit. A comprehensive or a phase 2 treatment is basically alignment of teeth, bite correction, closing extraction spaces if we decide to take teeth out, bring in impacted teeth, and things like that. So that's usually done when we have all of the adult teeth in. These are some of the appliances that we use every day. So most of you are probably familiar with the traditional metal brackets that most of us probably had as kids. There's also ceramic brackets, which are clear. You can still see the wires, so it's kind of a patient preference at that point, whether they want the metal or the ceramic. There are also some offices that do lingual braces, meaning they do braces on the back sides of your teeth. And then there are clear aligners, which is Invisalign. However, the patent for clear aligners has been expired for a few years, so there's a ton of different companies now who do clear aligners. I just know Invisalign is the most commonly known one. So if I refer to clear aligners, it can really mean any company that produces clear aligners. And for our office in particular, we use Invisalign. So a typical day where I work is sometimes it's a 2-doctor day, meaning it will be me and somebody else. On days like that, we have roughly 100 adjustments per day. On a 1-doctor day, we can have anywhere between 40 to 80 adjustments. So what do adjustments consist of? That consists of changing wires. So if you've had braces, you know that feeling. You go into the orthodontist, you leave the orthodontist feeling like your teeth are on fire and that you can feel the tightness and the soreness starting to kick in. That's because they increase the wire size. We'll be working on closing extraction spaces. We'll be doing Invisalign checks, making sure Invisalign aligners fit the way that they're supposed to, make sure the patient's wearing them the way they're supposed to, give them more trays if that's what's needed at the time. We will evaluate how well patients are wearing their elastics or their rubber bands. This can really help us correct the bite. Without proper elastic wear, it becomes very hard for us to correct bites. We can also do appliance evaluations, meaning expanders, Nances. There's just a ton of different appliances, and they all vary practice to practice on what each person uses, so you can be checking that. You can be doing retention checks, meaning you are checking to make sure retainers are fitting well, make sure they're not broken, tightening them if they need to be tightened. Bonding brackets, which would be, traditional metal brackets or ceramic brackets, or attachments. And attachments are little tooth-colored knobs that go on the teeth to help Invisalign move the teeth more predictable. And we do debonds of brackets, meaning we take the brackets off and we take attachments off. Depending on the day, we can see anywhere between 5 or more new patient exams or observations appointments, and these can include same-day starts if they're willing to get started that day. So what I wanted to do now is the more fun part of my project. I wanted to show some cases that I did in residency, just to kind of give you a little bit of an idea of what I do in a day. So this first case that I'm going to show you is just a traditional braces cases where we switched into aligners to finisher. So not every case has to be a super complicated case. Sometimes they're pretty straightforward, such as this one. So for her, what we did is we started with braces. We were in braces for about 2 years, and then we decided to switch into aligners to get some finishing touches for her done, because she was just tired of being in braces, which I totally understand. And this is how she ended. So a little bit of settling needed to be done on that right side, but overall, she was happy and I was happy, so it worked out really well. The next case I wanted to show you was extraction of 4 permanent teeth. So as we can see in this patient, we can see that there is pretty significant crowding, especially on the top arch. So I don't know if you can see my mouse, but if we can look at the picture of the top arch, which is on the left side of the screen below the profile shot, we can see that we have 2 lateral incisors that are pushed palatally, meaning towards the roof of the mouth. They've been blocked out because of crowding. On the lower, we can see that we have a box type of arch form going on too, with some crowding on the anterior area. So sometimes there's just so much crowding that we just won't be able to fit all the teeth in and make sure that the teeth are in a harmonious and functional position. So we elect to take out 4 permanent teeth. So with him, we took out 2 teeth on the top, 2 teeth on the bottom in order to get those, what we call lateral incisors, in place and give him a more oval-shaped arch form. So for him, he was in treatment for about 2.5 years to get all that space closed. And I'm going to show you a phase 1 case with an expander and thumb crib with limited upper braces. So like I mentioned before, a phase 1 case is an interceptive case. The patients don't have all of their adult teeth in yet, so we're really just trying to target a few main problems that the patient has. So for this patient, she's in what we call a cross bite. We like to see our top teeth and our bottom teeth fit together like a lid in a jar, meaning our top teeth fit over top our bottom teeth. So if you look at the center photo, the head-on shot, and we look down the patient's right side, we can see that her upper teeth are sitting inside of her lower teeth, meaning she needs some, what we call expansion, to be done in order to get her out of that crossbite. So we elected to do that with an expander. She also had a complaint of a diastema, which is the space that is between her front 2 middle teeth, which she did not like, and she had a thumb sucking habit. So we decided to combine the expander and the thumb crib together into one appliance. So this is what a expander looks like. So most practices use what we call a Hyrax expander, which doesn't have this pink acrylic on it. So this pink acrylic is what we call a Haas expander. So within the Haas expander, it's kind of hard to see in this picture, but there are metal zigzags here that kind of hang down, and that helps her remember to keep her tongue out of her mouth. So she'll put her tongue or her thumb in, and she'll feel them, and then she has to remember, oh, I need to take my thumb out of my mouth. And we continue to have that in until the habit is stopped. So with this, there's a key that turns a little lever in the middle here to help expand the palate to help get out of the crossbite. So we kind of used it as a double functional appliance here, doing the expansion and doing the habit stopping. We also did limited braces on her on the top. We just did the front 4 teeth for her to help close up that diastema. And now we put her in retention and we wait for all of her adult teeth to come in. So then we can start her phase 2 treatment. And right when I was graduating, she was getting a consult for her phase 2 treatment. So with phase 1, we like them to last anywhere between 12 to 15 months. just so they're not in braces forever, because sometimes kids will start to lose teeth really quickly and the adult teeth will start to come in, and then it just turns into this really long phase 2, and the patients tend to get burnt out with that. So we like to give a break between phase 1 and phase 2 if possible. I did also want to go over some pre-dental advice. So the first thing that I have is to get as much exposure to the dental world while you're in undergrad as you can. So talks like this are really great because you get to meet a ton of different professionals that all went to different schools, that all have different things that they can contribute to your learning and growing as a potential dentist. If you can get into shadow local dentists and dental specialists, I think that would be very helpful as well. I know when I started to shadow my dentist, he was like, hey, you do know that your first year of dental school, you're going to have like 30 plus credit hours a semester. And I was like, how is that even possible? Like, how do they even fit that in? And at the time I was taking like the largest course load you're allowed in undergrad, which is what, 12 or 15 credits. And I was like, I don't understand how it's going to be like almost double this. So that was very insightful for me. You can also attend pre-dental days at local dental schools. I'm sure this past year with COVID, it's been a little bit harder for dental schools to have these pre-dental days. But now that the vaccines come out and things are kind of taking an upward trajectory with getting back to a little bit of a normal lifestyle, hopefully those dental schools will start to have those pre-dental days again. And they're really great too, because usually what happens is they'll bring in part of the admissions committee and do mock interviews, and they'll kind of give you a little tidbits on what they are looking for in their students. You also get to do some hands-on activities as well. I would also join pre-dental ASDA. So ASDA is the American Student Dental Association. It's one of the largest student organizations in the country, and it represents all dental students. So the good thing about pre-dental ASDA is every single school has an ASDA chapter, so you'll be able to network with tons of people from different schools. You'll be able to attend ASDA conferences as a pre-dental. You can also have leadership roles within that pre-dental branch as well. And usually they'll match you up with a dental school big. It won't necessarily be someone who's close to your area per se, but it's always good to have that reference, that person that you can go to ask questions who, didn't go through the application process that long ago. So those would definitely be things that I would try to get involved in. So academics is important, but it's not the only thing that they're going to look at. So it's really good to, of course, get those good grades, get a high GPA. But you should also get involved with clubs and leadership roles within those clubs at your school. So if you are very passionate about playing chess, you join the chess club and try to get a leadership role with the chess club. Whatever it is that you like to do, still do those things. It's really important to keep hobbies and interests outside of dentistry and outside of school. I do think it's really good for your mental health, because if you're just doing school all the time, you will burn yourself out. And don't stress out if you don't get the grades that you want, because they do look at a very large scale of things besides your grades. I would also study and take your DAT as early as possible. So for me, I wanted to apply to dental school like the day that the application opened. And for me, that happened sometime in June. It might be different now, I'm not too sure. So I told my letters of recommendations a few months in advance to hey, this is when the application opens. They're gonna send you an email. If you can get that letter in as soon as possible, that would be best. I'm trying to get my application in as soon as possible. So definitely take that DAT early so you have those scores ready to go. Get your dental school admissions application in early as well. And I know the letters of recommendation is kind of out of your control because you're relying on someone else to get those in for you. Just keep reminding them they're only human. I'm sure they have 1,000 other things going on besides your letter of recommendation. I'm sure they have families outside of work. They have to deal with teaching multiple classes at a university level. So sometimes they just forget So I would just always remind them every so often. And I think the sooner you ask for it, the better, especially if one of them says no for whatever reason. Then you have to look for someone else. I also think that it's really important that we talk about point number 4, because I feel like the topic of the cost to become a dentist is kind of thrown under the rug. At least it was when I was going through the process. So I do want to kind of hit on this. So to go to dental school is a lot of money. And unless you're rich, which I would be totally jealous if you are, you're going to need to take out student loans to afford the tuition of dental school, to afford living expenses while you're in dental school, to afford, the dental instruments that they may make you buy depending on the program. Just know that that gets expensive. It's like a wedding. So, you could have a birthday party and it'd be cheaper, but then the second you say it's a wedding, it's like exponentially more expensive. So I would just keep that in mind. So I don't mind sharing my personal student debt load because I think it really helps put things into perspective for some people. So I went to Nova. Nova is not notoriously known for being a cheap dental school. Because I didn't get in right away and I did the bridge program, it was the only dental school that I had as an option. So if you have an option, definitely think about cost, because relatively speaking, you are going to be getting relatively the same education no matter where you go. So definitely take in the tuition as a factor in your decision. So for me, I went to Nova. 4 years of tuition, dental expenses, and living expenses put me $500,000 in the hole. Thankfully, I had no debt from undergrad, so it was literally just a dental school. Then when I went to residency, I did have the same, I had tuition, and I had living expenses, and I had my orthodontic equipment, and that probably added about $180,000. So including interest and everything, thank God COVID put a pause on interest, so it's saving me thousands of dollars. My total debt comes out to $757,000, and that's literally just dental school and ortho school. So sometimes in residency, it's a little bit easier to have a job on the side, whether you work a night clinic as a dentist or do dental work on the weekends to make some side cash. However, in dental school, it's really hard to do that. You're in class from 8 to 5. If you're not in class, you're studying for, all those 32 credit hours that you're taking. And if you're not studying, you're practicing your hand skills and practicing your clinical abilities, so it's almost impossible to hold a job while you're in dental school. I'm not saying that some people don't do it, but it's just very, very, very hard to do that and maintain, sleep and all of that into it. So just make sure you know what you're getting into as far as tuition goes. Again, if you don't get in the first time, don't get frustrated. For most people, it does take multiple application cycles. And probably another really important point, number 6, take an art class to get dexterity and hand skills. For me, that wasn't something that came easy or natural, and I am one of those people where a lot of things do come easy and natural to me. So it was very frustrating when I had to spend that extra time to get good with using my hands and my dexterity. So if you can, take an art class, whether it be through your university or something that you do on the side as just like something for fun, definitely get used to being good with both hands, because you will need that. So I'm done, and if anyone has any questions, I'll be happy to answer them.
Thank you so much, Dr. Foster. That was really, really good. I think sharing the debt aspect especially is important, and then also your definitions, I think, because we don't really have a background, just going over that was really helpful. So we do have some questions from our Instagram and then also our YouTube.
Sure.
Okay, so we'll start with kind of before dental school. So what were some factors you looked at when applying to dental school, and like what was at the top of your list versus the bottom?
So I honestly don't think I was well prepared for applying to dental school as maybe I should have been, because there were a lot of things that I did not factor in. I kind of just factored in like where I would want to live, which is like a very terrible thing to just base your dental school on. But at the time, I feel like a lot of these things weren't like these shadow experiences and like pre-dental things, like I just didn't know about them. So I think that probably did me no good either. So honestly, I didn't do a really good job, but I do think the things you should consider are class size. To me, class size is very important. I prefer to have that larger class size just because then you can be exposed to different people, different types of people, different cultures, all these other things that you're going to need to be able to work with while you are practicing dentistry. So you need to be with people who aren't necessarily exactly like you. Big class size is good for me just so you can get different experiences with different types of people. Tuition would definitely be one of my number one factors if I could go back and do it again. And then as far as clinical abilities, I wanted to make sure that I went to a program that was known for producing good dentists. So those were the types of programs that I applied to.
Awesome, thank you. So do you think that prestige should be, I guess, a factor? Let's say you get into Harvard or Columbia versus like an in-state dental school. How much do you think that should play a role in your decision?
Honestly, I've never had a patient ask me where I went to dental school, nor have I had a patient ask me where I did my residency at.
Mm-hmm.
So I think from a patient perspective, they're not going to care whether you went to Harvard or whether you went to University of Maryland, say. Like, they're not going to, care that you went to a public institution versus a private institution. They're just going to care, are you a good enough dentist to, take care of my chief complaints and my dental concerns, or are you not? So I think as far as prestige goes, I wouldn't put too much importance on prestige. Just like I said, you're going to be getting relatively the same education no matter where you go.
Okay, thank you. So how did you manage the transition to more credits? You said that it doubled. So what was kind of your mindset and how did you kind of conquer that?
So I think for me, I got lucky because I did half those credits essentially in the bridge program. So I got really lucky in not having to take that full course load that first year. And then I was only able to focus on those dental classes, which was good for me because I did struggle with that dexterity, like I said. As far as going from first year to second year, where then technically the credits did double, it was that transition. So you just have to be really good at time management. Unfortunately, you're always going to feel like you're trying to keep your head above water while you're in dental school. I don't necessarily think that that's a good way for school to be, but I think just kind of that's the nature of the beast. You're always going to feel like you're behind. You just kind of take the hits as they come. For instance, for us, October was called Helltober because we had literally every single class we ever had a final. Like, sometimes you had 2 or 3 finals or midterms in like 1 week, and you're like, how am I supposed to do this? And then you just, as long as you are good at like time managing and managing, like, okay, this is what I'm struggling in the most, so this is what I need to, pay the most attention to, and vice versa, I think you'll be good. Also with the science classes, you will have most likely have taken them already in undergrad. So I'm not saying that they're easy because they're not easy, but you already have had some exposure to them. So that does make it a little bit easier. But I also think instead of just like studying all the time, 24/7, you have to make sure you're making time for yourself too, because that really is going to help you during dental school.
Yeah. So do you have time for like clubs or organizations in dental school?
So yeah, you definitely do. And a lot of dental schools offer a ton of different clubs. So at our dental school, for instance, at NOPA, almost every single specialty had a club. There was ASDA, which I was actually president of. So you definitely have that time to take on leadership roles if you want them. we had some international specific clubs. I'm trying to think on what they were. There was like a Hispanic Dental Society club. There was an Asian specific Dental Society club. There was a DIA, which is, I'm trying to think of what that stands for, American Dental Education Society or something like that. There were dental specific fraternities, which were really cool. So at our school we had SIO and AO, and those are really good to help you keep, that social part of dental school as an aspect as well. So there's definitely time to be involved with other things besides just studying, being in the library and things like that.
Yeah, that's good. So how is the master's program compared to undergrad?
So that first master's program I did was, I feel like I blocked it out of my memory because it was a terrible time. It was very stressful in the fact that you knew that your dental school seat was kind of hanging over your head. So you had to really, while you were only doing those half the hours that the dental students were, I feel like they were more stressful because you had to get that 80 or higher where they could get the 70 or higher and be okay and move on.
Yeah.
So it was definitely a change of pace. For instance, in undergrad, I worked 2 jobs and was in a sorority and was in some clubs, and I was shadowing a dentist. And that, school never really, hindered any of that for me. And I feel like once I got into the master's program, it was more coursework, more material, and things like that. So I really just had to change what was important to me and how to manage my time. I think that first couple months was just me learning how to manage my time to get everything done that I needed to get done. So I'm a very schedule type person. I still carry around a planner that you write in, and I cross things out. That's how I keep track of what I need to get done in a day and how much time I'm spending on each project throughout the day. And I think that if you get into the habit of being conscientious about how you spend your time, it will help you get through the course load.
Yeah, I understand. I literally have my planner right here. So I'm definitely writing stuff down all the time to stay organized. So did they require you to retake the DAT or boost your GPA, or was it just, or did they require you to shadow or just the master's?
Yeah, so I was just take the science classes and get the B or higher. In order to apply to the program, I had to have taken the DAT previously, so they already had my DAT scores. They already had all my transcripts and everything. I feel like I was a pretty competitive applicant, so I'm not sure what the issue was on why I didn't get in or get an interview. So I'm not sure what the issue was there, but I was competitive enough to get into this master's program. And there was only 5 seats for dentists, and then the other seats went to medical seeking students, degree students. So I was one of 5, and I just happened upon it just by Googling master's programs that don't require a thesis, because I was like, there's no way I'm going to spend 2 years doing a master's program and do a thesis when I don't even care about it.
Yeah, I understand.
However, that program has been revamped since I took it, and I don't think it's the same anymore.
Oh, okay.
Yeah. So I know both Nova and Berry University, which is in Miami, have these biomedical type classes where basically the faculty is the same faculty and they teach the same stuff. But I don't think that they hold the spot anymore, unfortunately.
Okay. Thank you. So you said that debt was a huge factor when we should consider becoming a dentist or a specialty. So how hard do you think it will be for you, or just in general, to pay that off?
I get anxiety thinking about it every day.
Sorry.
No, that's okay. And I think it's a really great topic, and I feel like a lot of people don't discuss this topic, and I do think that's really important that you know what you get yourself into. So thankfully for me, I decided to specialize, so my income will definitely be probably higher than most dentists. However, insurances, as far as dentistry goes, are cutting back on how much they're reimbursing dentists for their work, which is super unfortunate. So that's definitely something to think about when kind of thinking about that debt to income type ratio.
Mm-hmm.
Also, luckily for me, my husband is an endodontist, so,
Oh, wow.
and he doesn't have student loans, thankfully.
Wow.
I know. He's an only child, so his parents pay for it, and I hope he can hear me saying that because I'm super appreciative of that. I'm super appreciative that they did that. So when he starts working, I'll be able to basically just put all my income into my loan, and I think that I won't have a problem paying it back. But it is a scary number to think about. And there's a lot of changing things going on right now between the COVID relief and the possibility of getting rid of the tax bomb. There's just a lot of stuff going on within the government regarding these student loans. So it's really hard for me to even say like, oh, I'm going to pull it out, I'm going to refinance it and pull it out of the government, just because right now it's benefiting me to keep it in the government. But my interest rates are so high. They're so high that it's just like incredible that they have them so high. But I think most dental professionals are going to be okay with paying back their student loans.
Okay, thank you. So is the orthodontics residency competitive to get into? And then how important are dental school grades?
So yes, so ortho is one of the most competitive to get into, I would say, next to oral surgery. So I would say oral surgery and ortho are probably the most competitive. I'm sure people will argue that with me from other specialties, but that's kind of the tendency that I see. Grades are very, very important. They are going to ask you about your class rank, when in my mind, class rank shouldn't be such a high importance to them, because the difference between the number 1 person in the class and the number 10 person in the class is literally like 0.001 of a point. Wow. Like it doesn't tell you anything about the person. So they do take dental school grades into account. If you're thinking about specializing at all in any field of dentistry, I would still work your butt off in dental school. Don't just try to skate by, get the minimum grades. Make sure you still keep your grades high, even if you think that you're going to consider it, because I know plenty of people that are like, I'm not going to specialize, I don't want to do it. And then the time comes and they're like, well, I want to do it, and now I can't because I skated by the last 3 years in dental school. So I definitely think it's important. They also are going to look at your extracurriculars. So you still want to get involved with those clubs. You still want to get those leadership roles. You still want to go above and beyond. I would also recommend getting some research experience. I think most programs require some sort of research, such as a thesis topic to do while you're in residency. So there are a couple different ways you can do it. We had a research club. So in the research club, they would help you find students who were doing research, and you could join their research. You could help out with faculty research or whatever specialty you're interested in. You can go up, ask one of the residents if they need help with research. So I would definitely get that on your resume as well.
Okay, awesome. So how would you say, or how hard is it to get a job out of, for you, I guess, and then also just out of dental school, or if you do a specialty?
So for me, I kind of freaked out about finding a job because I thought it was going to be way harder. And it turns out it wasn't as hard as I had thought. So what I had done was I started way in advance. So I started almost a year in advance. I know for us, we have the AAO, and the AAO has kind of like a side section where you can like pick like where you want to live, like what area, and they send you, ads for people who are looking for orthodontists. So I did that. I also kind of like cold turkey just emailed orthodontists in the area that I was going to be at, and that actually happened to work out really well for me and my current job. So a year in advance, I came to North Carolina. I visited a few practices, and then I kind of like was like, oh, these are like the ones I could see myself working with. So then I like followed up again in April. Well, it was a little bit sooner than April. It was before COVID. And I set up, another time to come in to do a more formal type of interview. COVID canceled all those plans. So I ended up doing a Zoom interview or a FaceTime interview. And then I was coming back in June to help my husband move to the area. So I did a more formal interview then, and that's when they offered me the position at where I work now. And I'm really thankful for that, because that was where I was, like, in last December of 2019. I was like, this is where I really want to work. And I was telling my husband, like, I hope they want someone like me, like, when the time comes, because I know I was looking really early. And sometimes it's even good to look early, because even if you don't necessarily work with that person, you at least have that connection, which is good. It's always good to have connections in the areas.
That's awesome. So do you
work? Oh, sorry. I was going to say, and as far as dentistry goes, I know, unfortunately or fortunately, depending on how you want to look at it, corporate dentistry is becoming very popular. And I think a lot of people are finding jobs through corporate dentistry after graduation. If you wanted a more private practice type of job, I think that might be harder to find, but not impossible. Just probably a little bit harder to find.
Got it. That was actually my next question. Do you work in corporate or private?
I work in a private practice, and we're more like a large group practice. So I work with, I'm the 5th orthodontist. So there's 5 of us, and we rotate through 3 different offices. So it's not corporate, it's a private office.
What would be like the biggest differences between the two?
I don't really know, because I don't work at a corporate office, so I don't really know how their systems are in place. I just think that we have really good quality control, and we're not forced to make treatment plans that we don't believe in. And I think that that's really important, to not have someone saying like, oh, you need to have this many, like, say, crowns in a month, or this many fillings in a month, or this many dentures. Like, I don't like when someone puts these ceilings and walls on you when you're the provider, and you should be able to make the best clinical decision for your patient.
Yeah. So how does your office stay up to date with new technologies and equipment, or what is kind of the process to get used to new equipment?
So we have a pretty good amount of new equipment. I know we just got new iTeros, the newest iTeros. We were the first one in, I think, North America, which is really cool.
Oh, wow.
So because we do so much Invisalign, we're really able to learn a lot about it, which is nice. So there's like CE credits that you can take and conference calls that you can be on that help you learn that new technology. I know usually like the reps will come in and teach you those things as well. But right now, because of COVID, reps really aren't traveling. So it's mostly kind of relying on CE credits and stuff like that to keep up to date with everything. And as far as, so CEs are continuing education credits. You need them to maintain a dental license. So in North Carolina, I need 15 per year. And then in Florida, I need 30 every 2 years, because I have 2 licenses open. So you'll need to be taking those anyway as a provider to make sure that you are keeping up with the most up-to-date information.
Got it. Okay, so someone from YouTube asks, do high school grades matter when applying to dental schools?
No, they're not. They shouldn't look at your high school grades. I don't even think I had to send a high school transcript or anything. So they're just going to look at your undergrad grades. They won't look at high school.
Okay, awesome. And then any tips for applicants with a low GPA?
So depending on how low your GPA is, you can always take some additional classes like in between undergrad and dental school, not necessarily a master's, but sometimes you can just take like an anatomy class or, a biology class or, some sort of class in between, like doing a post-bac type of thing. Sometimes that can fluff up your GPA. I would also recommend trying to get the highest DAT score you can get, just because if you don't have that high GPA, you do want to have that high DAT to maybe be like, hey, well, I might have messed up a couple classes in, undergrad, but look, I studied really hard and did really good on the DAT. So you can kind of maybe counteract it like that, but a lot of people will recommend doing those fluff classes after undergrad.
Okay, so for the DAT, like you mentioned, start early and reviewing. So when did you start studying, and do you have any tips or resources that you use?
So I know the DAT has been reformatted a little bit since I took it. I did not take it as early as I should. So I took it for the first time in July. So after the application cycle had opened, and I wish I had taken it sooner. So I would say to take it like April, May-ish, before the applications open. I used the Kaplan Blue Book to start studying, and then I did the DAT Destroyer as well. I didn't get a good grade on it the first time. The second time, I got a little bit better of a grade. But I'm not good at standardized tests, so that should not be a gear towards any of that. But yeah, I would definitely use, I think there's DAT boot camp now, and I heard that that's really good. So
yeah,
I would definitely start sooner rather than later, because it's a lot of material. It's basically like every single science. It's perceptual ability, which I found to be pretty challenging. The perceptual ability is taking a lot of 2D images and turning them into 3D structures in your head. Because in dentistry, you take x-rays. X-rays are 2D images of 3D structures, so you really have to learn how to manipulate those in your head in order to be a good clinician. So that they really kind of hone in on that PAT section. So I would definitely study for that a little bit more than probably the other things, depending on how well you are with the sciences.
Makes sense. Okay, so you mentioned research in dental school for residency, but how about undergrad? Were you part of any research, or do you recommend it?
So I was part of research in undergrad. So as much research as I've done, like I literally have always hated research. In undergrad, I actually had to do a thesis project in order to graduate with my major. So I did a research project. It was able to be a group research project, which was nice. So it was me and 4 other colleagues, and my research was not medical related at all. It was actually related to snakes, which was really odd, but it was related to snakes.
That's interesting.
And they did ask me about it in my master's interview, and I just explained it to them. My university was not a big university for like medicine and things like that, medical type classes. So it was a lot of like ecosystem, like plant, animal science type of classes. So that's kind of what my background is in as far as undergrad. But I would try to do some research if you can in undergrad. It will only help you. It won't hurt you. And then I was on 2 research projects in dental school with orthodontic residents. And then I did my own research project in residency.
Oh, wow. So you did a lot of research, even though you didn't like it.
I still hate it.
Okay, so someone asks, would you recommend orthodontics for people who are squeamish? And I guess extractions, the mouth, or anything, or dentistry in general. What would you say how to approach that if someone like is scared of blood or something?
Well, if you're scared of blood, I probably wouldn't recommend going into dentistry, because you are going to be seeing a lot of blood in dentistry. And part of dental school is extractions and surgeries and things like that. So you might want to consider if you're squeamish with blood, or try to get over that fact that you're squeamish with blood. There really is not too much blood in orthodontics. I mean, that's not why I got into it. I actually really enjoy like extractions and things like that when I was in dental school. That's probably the one thing that I missed. But if that's the only reason why you're going to go into orthodontics is because you're squeamish of blood, I would probably not recommend you do that. You really have to enjoy what you do, especially if you're going to be spending all this money to go do it. So I would really encourage you to think about what you want to do and make sure it's what you want to do before you kind of get in too far and then realize it's not.
Yeah. Okay, so you said that you liked extractions, but what is your favorite and least favorite orthodontic procedure?
I'm trying to think of what my least favorite. My least favorite orthodontic procedure is putting brackets on second molars, which are the teeth all the way in the back of the mouth. That's literally my least favorite thing to do in ortho. I literally hate it. You can't really see. patient's cheeks are in the way, patient's saliva is all in the way. You gotta make sure it's dry. They bite the brackets off. I just don't like bonding the teeth all the way in the back of the mouth, like the very last tooth. I don't like doing that. If I could avoid it, I would. As far as my favorite thing, like I said, I do like the surgical part of orthodontics. So I like to expose canines if I can, if they're in a position where I can expose them. I like if they're impacted. If it's something that's like a bony impaction, I'm going to send that to a surgeon, just because, for me to sit down and do a bony impaction type of surgery would just kind of clutter up the schedule in a flowing orthodontic practice. So if it was something like that, I would definitely refer it to an oral surgeon. But if it's something that's simple, where I just need to remove some of the gum tissue in order to get a bracket on it, I like doing that. I like doing TADs, which are temporary anchorage devices, which are kind of like screws that you put in order to help with some of your mechanics. I do like placing those. And I do like doing propel, which is where you put like little perforations in the bone around the tooth to help it move. The research is kind of conflicting on that, on whether or not it actually helps, but it's still fun to do.
That's cool. Okay, so you said sometimes you'll refer out if there's surgery. So what are like some things that you'll 100% refer out? And then what is the process of explaining that to the patient who are like, I guess, hard, or like they don't understand why you can't just do it?
Sure. So I think a lot of patients are very understanding when we refer out. So for instance, I will refer out for, like I said, a bony impaction. I'll refer out for extractions of wisdom teeth. I'll refer out for extractions of adult teeth in order to, make room for all the other teeth that kind of fit together. I will refer for a frenectomy. I think some of the orthodontists in our office might actually do a frenectomy, but I would just feel more comfortable referring that out. That's when you cut the attachment either from your lip to your gums or kind of where your tongue is behind your teeth. That would be something that I would probably refer out. Anything that's like cosmetic bonding to make teeth look different, I would refer out, just because I haven't done stuff like that in a really long time. So if you had me build up a tooth to make it, so sometimes people have what we call peg laterals, which are smaller laterals than what they're supposed to be, and they'll just look better if they get built up and look more like a normal lateral. So I would send that to a dentist to be done. They do it all the time, so they just have the ability, have the materials to make it look really nice for the patient. Patients are pretty receptive of it, just because you're making sure that they're getting the best care. And as long as you're making sure the patient comes first and that their best interests are being held high, I think they really appreciate it.
Awesome. Okay, I think we have time for one or two more questions.
Okay,
so
great.
What would you say that the residency or dental school is harder?
I do get this question a lot, actually. I think they are different types of hard. So for instance, in dental school, your first 2 years are learning everything about dentistry that you can possibly learn. And then the last 2 years are actually performing dentistry. So you already have that background knowledge on how to do things, and you've been practicing it on those fake teeth, and you've been practicing, in class and your free time and things like that. Residency is a little bit of a different type of hard. So in residency at St. Louis, for instance, we have like our first month is called boot camp, where you like try to learn everything about ortho, but like you still are like, I don't know what you're talking about. And I think dental schools do a really bad job at teaching ortho. So when you get to ortho residency, you're still just as lost. So that first month, you're trying to learn everything about ortho, but you also are treating your patients. So at SLU, we got 60 patients that we started and about 20 to 30 transfers that you get throughout the program. So you'll be treating these patients, and the faculty are there. The faculty will be like, the first few months to a year, they'll be like, okay, I want you to do this next. And then you do it. But you're like, I don't know why I just did that. And then you ask, and then they explain it, and you're like, okay, I still don't get it. But then you have another patient. So you end up learning about it in a class like a week from then. And you're like, oh, like now this makes sense. So they always talk about like, there's a click with ortho. So there's a part of ortho where you're doing it and you're like, oh, now I understand why we do things the way that we do things. So it's just different because you're kind of learning and doing at the same time instead of learning and then doing later on. So I think that's the interesting part of residency. But it works, and they, give you a good foundation to go out and practice. And you're going to be a continual learner. You're not going to know everything all the time. You could be practicing for like 40 years and still not know everything. It's impossible to know everything. So as long as you are aware that you don't know everything and that you're always trying to learn and get better, I think that's really important too.
Awesome. Okay, thank you so much, Dr. Foster. You did an
you're
amazing
welcome.
job, and the question and answer was really helpful because you were honest and like let us know the good side and the bad side. So I think it's helped a lot of people. So that's it.
Thank you for having me.